Hey folks, it's Beth Wright, and I am doing your podcast for Chapter 59. This is for NUR 237, Unit 5. And these are going to be talking about, this one is going to be talking about medications used to treat disorders of the ears. And so our exemplars are Neosporin, Polymaxum B hydrocortisone, and then the Cipro, that's misspelled, sorry about that, ciprofloxacin and amoxicillin. And so we want to talk about otitis externa first, and that is where we have an outer ear infection. Very tender and painful to touch. Earaches are very painful, and of course we usually see these in the summer months and when there's a lot of swimming going on, exposure to water. And so, of course, prevention is going to be things like wearing earplugs and keeping the ear dry and protected, and it tends to be worse at night. Now, you can actually have necrotizing otitis externa where the symptoms are severe otalgia, which is, ear pain, and otorrhea, which is drainage, and it can actually even be purulent drainage as well, so pretty bad. So the treatment for otitis externa is going to be the neomycin polymaxum B hydrocortisone. So obviously we have a combination drug here, and of course the pharmacological therapy of choice is going to be how severe it is. It's going to be also an otic preparation, so that needs to be looked for on the container of the medication. Systemic medications are indicated if there's deep tissue involvement outside of the external canal, or if you have someone that's immunocompromised. Now, the neomycin polymaxum B hydrocortisone is both an anti-infective agent, and it also has the hydrocortisone, which is an anti-inflammatory medication, and it inhibits bacteria and, of course, decreases the inflammation there. Adverse effects can be burning and stinging, and ototoxicity, meaning, it can harm the hearing. Prior to administration, we should look to see about the tympanic membrane. It can be ruptured because of ear infections or chronic ear infections and that kind of thing. So we do need to call that to the attention of the physician. Contraindications are going to be any allergies to any of those medicines, viral or fungal infections as well. Because those don't work. Anti-infectives don't work with that, and we shouldn't use cortisone for those kinds of things. And of course, we got to teach the patient about how to administer, and the other thing is being sure to talk to them about how long to take the medication, and that being finish the prescription, as it is problematic. A common thing with people, when their ears start feeling better, they stop taking the medicine, and so we need to tell them to finish the medication as prescribed. The ciprofloxacin is again for that necrotizing otitis externa, although you may see it prescribed for just regular otitis externa too. You can do IV and then switch to the PO. The dose does need to be renal adjusted for renal impaired, and the most frequent adverse effect is the GI issues, nausea, vomiting, and abdominal discomfort. Also, they can have dizziness and mild headache, and reports of allergies and skin reactions, of course, always needs to be reported and a concern. And another thing with this medication is the photosensitivity, so they need to be careful about exposure to sunlight with this med, and they should use screen when they're out in that, and protective clothing as well. And also there's a risk for that tendon rupture or tendonitis with this, so we need to be sure to tell them to report that, and of course any allergies or any other problematic adverse effects. So teaching exposure to sunlight and apply that sunscreen and special clothing. For the CNS effects, if they get dizzy or lightheaded, of course they don't need to be driving or operating heavy equipment. They need to stay well hydrated, and they need to avoid calcium fortified juices and dairy products while taking the drug. They need to avoid antacids, zinc, or iron products during the course of treatment as well, and of course report any other problematic adverse effects. Now, otitis media is something that we see more commonly, and that is an infection of the mucous lining of the middle ear. And again, earaches are very painful. I've had a number of them in my lifetime, and they are very, very painful, and it can rupture that eardrum and cause issues with with balance and equilibrium. Usually the ear infections are caused by bacteria. That occurs when fluid builds up behind the eardrum, and that's the eustachian tube gets clogged up, and then we have a backup in the fluid, and then we get an infection. And of course anybody can get an infection, but children tends to be the most that's seen. As a matter of fact, 3 out of 4 children will have at least one ear infection by their 3rd birthday, and they're the most common reason why people bring children to the doctor. Now the causes again can be bacterial or it can be viral. Upper respiratory infections stimulated by viruses set up inflammation and an environment conducive to infection. It can be acute and chronic, and it can be with effusion, in other words fluid, or it can be without. And so a lot of times this is where we'll see children get the tubes put in to help with the drainage. As a matter of fact, my grandson just recently had that done, and the doctor said when they were cleaning out in there, it was like glue had set up from his repeated infections. So signs and symptoms with children, especially tugging and pulling at the ears, and fussy and crying, and trouble sleeping, and fever maybe, fluid draining from the ear, and there may be some issues with the clumsiness or the balance issues, and of course trouble hearing or responding in a quiet voice or quiet sounds. So treatment for this is going to be the amoxicillin. That's your most common one. And of course the big thing with that is the adverse effects. We can have the most common adverse effects is hypersensitivity, because a lot of people are allergic to penicillin. So we got to be very careful with that. But the GI effects can be glossitis, stomatitis, gastritis, sore throat, nausea, vomiting, abdominal pain, and diarrhea. And we know we can get a super infection from this medicine as well. So we want to be aware of that and teach about that, especially like your Cipro and those heavy duty antibiotics like that can cause vaginal candidiasis, and other thrush can occur as well. It's contraindicated, of course, with the allergies to penicillins. Also, cephalosporins should be avoided with this medication as well. And any allergies, for instance, they may be allergic to mold. So mold is penicillin, so we got to teach about that or check about that as well. If a fever is present, Tylenol will help, but it won't help with the inflammation. And I've found personally, and with my kids and grandson, that the ibuprofen tends to work best, and it's that inflammatory, the anti-inflammatory that helps with that. Of course, if it's a viral thing, antibiotics won't help. and can cause issues with resistance, so we need to be aware of that. And side effects such as diarrhea or gastric upset may make the child actually feel worse. We need to teach about taking a full course of the antibiotic and not to discontinue them if the otitis media is improving. Untreated otitis media can lead to a loss of hearing, and I'm a witness to that, or testimony to that. I've had several in my lifetime, and I do have hearing loss. Of course, pain and the rupture of the tympanic membrane. I had that as well. We know that the spread of bacteria can go deeper into the cavity, sinus, and brain. So we got to be, teaching people about, get things checked out. And of course, difficulty with balance and gait can occur, and impaired speech can occur because of the lack of hearing. So, preventing ear infections, we want to teach our patients and parents about ways to prevent, and of course, smoking or exposure to secondhand smoke has been found to cause ear infections and ear problems. So, children especially don't need to be exposed to that, and air pollution even can be an issue with that. Teaching parents about keeping the immunizations up to date can also be helpful. Breastfeed for 12 months or more for immunity purposes. And to be sure to bottle feed the children in the upright position so that they don't, have that bottle and stuff in the bottle going back into that throat area and having some nice median for bacteria to grow. Okay, that concludes your podcast.